Have you ever thought about your options after MBBS? Yes? No? Maybe? Don't worry, I got you back. What is up YouTube, Dr. Waji here and welcome to my channel where I help you achieve your dream of becoming a successful doctor in Pakistan or the UK. And I teach anatomy on the side. So if you haven't already, do subscribe to my channel and hit that bell icon to stay notified of the latest videos. In this video, we're going to talk about what exactly can a doctor do with their MBBS degree. So without further ado, let's begin. First, you'll have to complete 5 years of medical school. Once you have your MBBS degree, you can apply for house job. You have to complete 1 year of house job and pass the NLE exam to register fully with the PMC. If you graduated before March 2020, you don't have to give the NLE exam. But if you graduated after that date, you will have to give the NLE exam to fully register with the PMC. For anything and everything about the NLE, check out my video in the top right hand corner. After you've fully registered with the PMC, you have two options. You can either go down a clinical pathway or you can go down a non-clinical pathway. If you're going down a clinical pathway, you can either go down a training pathway or a non-training pathway. After graduating, this is what most people believe they're destined to do. However, in this video, I'm going to show you that a medical graduate has way more choices. Talking about the training pathway, you will have a couple of options available. You can either complete an FCPS, an MSMD, or a diploma. In this case, I've used the example of MCPS. FCPS is a major diploma. In order to qualify for this, you have to pass FCPS Part 1. If you're going to practice in Sindh, you have to pass the entrance exams for the particular university you're applying to. After you've qualified, you have to undergo a 4 to 5 year structured training program, after which you're going to sit the FCPS Part 2 to complete your diploma. MSMD is similar in the sense that there is an entry-level exam called JCAT. Then you have to complete 4 to 5 year structured training program, and then there's also an exit exam. After completing either FCPS or MSMD, you will earn the title of consultant. Once you've become a consultant, the options are limitless. You can either pursue your academic passions and become a professor, or you can pursue your specialty of choice and become a subspecialist. You can also just work in a hospital at this level, or you can open up your own place and provide consultant services. MCPS is a minor diploma, takes 2 years to complete. In order to qualify for this diploma, unlike FCPS and MSMD, you don't have to take an entry-level exam. You just need to have completed your house job and be fully registered with the PMC. After completing this diploma, you will be categorized as a specialist, which is a middle grade doctor, and your license will allow you to practice more independently in a more specialized field, and you will have more decision-making powers compared to people that haven't completed this diploma. Moving on to the non-training pathway, you have several options in this category, but I'm going to talk about two of the most common ones. The first one would be working as a resident medical officer. Now, what most people do is after completing their 1 year of house job, they will apply for this position. This is a great position to have if you're trying to gain some clinical experience in the specialty of your choice or trying to improve your portfolio. RMOs are generally a temporary role that people use to fill the gap while they're applying for training positions. However, some people might choose not to apply for training and continue down this path. As the years go by and a person gains more experience, they're considered a SMO, the senior medical officer. So they do find that their pay increases slightly. However, they are not paid as well as their training counterparts. Someone who has completed their FCPS or MSMD and works as a consultant is going to be earning significantly more than someone that chose this non-training pathway and worked as an SMO. The second option, which pays way better, is working as a general practitioner or a GP. So after completing your house job, PMC does not require you to pass any special exams to work as a GP. They might in the future, but they don't as of yet. So if you can get a loan or have the money to open up your own place and start practicing general medicine, then nobody's stopping you from doing that. This is by far the most lucrative option when it comes to working as a doctor, because while your training counterparts are earning significantly less during their training years, GP starts to earn considerably more from their earlier years. This pay gap is sealed once training is complete and a person becomes a consultant. Do keep in mind that a GP is only allowed to practice basic medicine and manage acute medical emergencies. They are required by the law to make referrals wherever specialist intervention is needed. If a GP wants to improve their credentials, they can always leave their practice and go into training. However, most people don't opt for this option because they have a very steady income flow with their basic medical OPD. Moving on to the non-clinical jobs, you have several options when it comes to this. The four most common options would be working in public health, medical academia, health administration, or clinical research. Masters of Public Health is a 2-year master program that will significantly boost your portfolio. If you have a Masters of Public Health, then you will most likely be working alongside the government to implement healthcare initiatives to prevent the incidence of disease in a community. It can be a very lucrative career option if a person is able to ascend the ranks in their career. Check out some of the useful links I've provided in the description below about Masters of Public Health to get a better idea about what exactly is MPH and the career opportunities that await you after you complete this degree. Next up, we have medical academia. The entry-level position in medical academia would be a demonstrator. This is basically a junior lecturer, which is an extremely chill job for all of you that aren't looking for something very ambitious. You will be teaching medical undergraduates a basic science subject like anatomy. While this position doesn't pay very well, the hours are great, the job is very fulfilling, and you get the weekends off. After gaining some experience as a demonstrator, you have two options to further your career. You can either become a scientist in the subject you enjoyed teaching, or you can become a teacher. MPhil is an advanced research program that will give you a in-depth understanding of a particular subject that you enjoyed teaching. For example, if you started off as an anatomy demonstrator, you can complete an MPhil in anatomy or any other basic science subject that you want to explore in depth. MHPE is a Master's in Health Professions Education. In this master's program, you will learn different teaching theories and how to implement them in practice, how to design curricula, and basically after this degree, you're going to be teaching lecturers, senior lecturers, and even professors the art of teaching itself, which is pretty cool. Both programs are 2-year programs. If you go down the MPhil path, you can qualify for a PhD, which might take you between 3 and 8 years to complete, depending on how fast you can complete your dissertation work. After you've become a PhD, you can work as a professor in a medical university, and your pay scale will be significantly higher than at these two levels. If you go down the MHPE pathway, then you can work in the medical education department as an assistant professor or professor, depending on if you have the right qualification and experience. Next up, we have health administration for all of you business-minded people out there. After completing your MBBS, you can quickly enroll in an MBA program, which is a 2-year master program, and after completing that, you can actually work as an administrator in any of the innumerable departments in a hospital. You could become the administrator for HR, you could become the front office head, you could work in the office of a CEO as an administrator. The opportunities are basically endless, and you would probably be making more than your clinical counterparts at an entry level, and eventually if you ascend the ranks, this is an extremely lucrative career option minus the stress levels of a clinical career. I'm gonna drop some useful links in the description for medical health administration and the career opportunities that await you. And finally, we've got clinical research. After graduating, you don't really need any specific qualifications to go into clinical research. You will start off as a research assistant and ascend the ranks as you gain more experience and knowledge about the field. This is an extremely important field in the sense that it is the backbone of the evidence base we use to practice medicine. It might not pay as well as its clinical counterpart, but it is a great option for all you curious minds that prefer the academic and theoretical side to medicine and want to make newer discoveries. And that's a wrap, folks, on a basic overview of the possible career options you have after completing MBBS. Now, mind you, this was a very basic chart, and the possibilities are way more than the ones I just talked about. If you're talking about the non-training pathway, you also have tele-ICUs opening up where you can work as a RMO. If you're talking about medical academia, you can also work as a medical writer. There are several options open to you after completing MBBS. And I would strongly advise you guys to explore these fields so that you can customize your career path according to your own passions and skills. Remember, these pathways are not rigid pathways. They can be interlinked. Some people choose to complete FCPS and then get a Master's of Public Health degree. Some people choose to work as an RMO for a little while and then go into health administration. So it's pretty variable and really depends on your own circumstances. I wouldn't say that any field is better than another one, because you gotta tailor your field according to your personal circumstances. My 2 cents for anyone trying to pursue a clinical training pathway would be that after you've completed your house job, do give this clinical research a go. Work for a little while as a research assistant or associate, and you'll be able to learn a lot about research methodology. Because remember guys, if you do want to become a consultant or a specialist or a professor, you are going to need research publications. So some understanding of how research is done will serve you well. Good luck with whatever you decide to choose. Remember, you have all the options in the world. You just have to explore them. Do let me know in the comments what you thought about the video. This is Dr. Waji signing off. Adios.